I am Melinda Neuhauser. I am the pharmacist and acute care lead for the Office of Antibiotic Stewardship. Next slide. And for today's presentation, similar to I have done the last several years, in the next 30 minutes, I'll provide an update on the uptake of the 7 core elements of antibiotic stewardship in hospitals. I'll also discuss the priorities of stewardship implementation. And we also are excited to share new and updated hospital stewardship resources, specifically tools that outline how you can use NHSN AU data for action. Next slide. Ensuring appropriate use of antibiotics or antibiotic stewardship is one of CDC's 5 core strategies to combat the threat of antibiotic-resistant infections. Next slide. Most of you know the hospital core elements of antibiotic stewardship is a framework that the CDC released in 2014 and then updated in the fall of 2019. The core elements outline structural and procedural components that are associated with successful stewardship programs. Next slide. We leverage the antibiotic resistance and patient safety portal as a data and surveillance tool for the stewardship community, including hospitals, healthcare systems, and health departments. For those that aren't familiar with the portal, this is an interactive web-based application that displays data collected through NHSN, the Antibiotic Resistant Laboratory Network, and other sources. The portal offers enhanced data visualizations on antibiotic resistance, use, and stewardship. Next slide. Here is a screenshot of the portal. One of the ways we track antibiotic stewardship implementation is by assessing the uptake of all 7 hospital core elements. These data are self-reported to CDC yearly through the NHSN Antimicrobial section of the annual hospital survey. Next slide. Here you can see the number and percent of hospitals meeting all 7 core elements reported to the NHSN Annual Hospital Survey from 2014 to 2022. In 2022, nearly 97% of over 5,000 US hospitals had a stewardship program that met all 7 core elements. Next slide. With such a high uptake of the core elements in hospitals, we released priorities for hospital core element implementation in the fall of 2022. The priorities are supplemental guidance meant to help hospitals that have already achieved all 7 core elements to further enhance the quality and the impact of the stewardship programs. Next slide. The priorities are derived from the hospital core elements, and they highlight a subset of effective stewardship implementation approaches that are supported by the evidence or recommended by stewardship experts. They provide hospital leadership and antibiotic stewardship programs opportunities to expand their stewardship activities. Next slide. On the left-hand side, this is a screenshot of our recently updated website. Priority website links to different resources mapping the NHSN facility survey questions to the respective priority core element. Similar to the hospital core elements, we have the mapping as well as we have the functionality within NHSN Analytics to see the uptake of core elements at your facility or healthcare system if you have the group function. Next slide. The priority core element uptake is also tracked on the patient safety portal. Here's a screenshot. Overall, 10% of the hospitals met all 6 priority elements in 2022, with the highest uptake for the pharmacy expertise and action core elements, and then the lowest being tracking and reporting. Next slide. Although only 10% of hospitals met all 6 priority elements, nearly half of the hospitals met 4 or 5 of the priority elements in 2022. By highlighting these effective stewardship approaches for the stewardship programs, we anticipate that the priorities uptake will increase over the upcoming 3 to 5 years. Next slide. We'll shift to hospital antibiotic use data. Next slide. Hospital antibiotic use surveillance is based on the AU data reported to the NHSN AU option, which currently has over 3,300 hospitals that have ever reported. These data are used to report the Standardized Antimicrobial Administration Ratio, or SAR, which is a risk-adjusted summary measure of AU. Hospitals can use SARs to track their AU, compare their AU to a national benchmark, and assess the impact of interventions aimed at improving prescribing practices. Next slide. Similar to the core elements, the SAR is posted on the portal. Annual updates are released every November for U.S. Antibiotic Awareness Week. Next slide. Hospitals and state health departments can also use the SAR data on the portal to compare their AU to their state distributions and potentially use these for state targets. Next slide. Here is an example of the map of the United States with the median SAR values in 2022 for the all agent SAR category for the adult population by state. If you hover over state, you'll see the 50%, the 50 percentile and the confidence interval. And in this screenshot, you can see Georgia as an example. Next slide. The data on the portal complements the NHSN AU option report, which is also updated annually in line with US Antibiotic Awareness Week in November. The annual report provides a summary of SAR distribution and percents of use within SAR antimicrobial agent categories in adult, pediatric, and neonatal patient care locations. The report can help inform stewardship efforts by showing hospitals how their SARs compare to national and state distributions. Next slide. On the NHSN AUR module website, we have real-life AU option case examples from hospitals highlighting how they have used their NHSN AU data for action. And we're always looking forward to having new examples, so please reach out to us if you have examples that you'd be willing to use our format and post on this website. Next slide. This year, the CDC funded the Duke Antimicrobial Stewardship Outreach Network called DASON to develop resources leveraging NHSN AU data. These interactive web-based tools are meant to show how hospitals can use their AU data to inform, implement, and assess antibiotic stewardship activities. This year it's been launched, and these tools also include video guides that demonstrate manipulation of AU data for different clinical scenarios. And the link to this interactive website is below. The videos are fondly called the StewTube, and they illustrate step-by-step manipulation of the NHSN AU data extracts. And then you can also have videos that show combining these NHSN data with additional data, potentially from your local hospital data sources, and then metrics using local data sources such as antimicrobial use by indication. Next slide. The interactive web-based tool illustrates 5 clinical scenarios based on stewardship experience for using NHSN AU data for action. We're really excited to post more examples of how to use NHSN AU data for action. The clinical scenarios are divided into 3 categories. The first category is using AU data to identify and inform stewardship opportunities for high antimicrobial use, such as an individual SAR category. The second is using AU data to address opportunities to optimize antimicrobial use. An example that is outlined in blue is the classic stewardship scenario for IV to PO conversions, and I'll provide more details on this specific example in the upcoming slides. And lastly, category 3 is using AU data to support other quality initiative implementation, such as HAI outbreak investigations. Next slide. So if you click on the individual scenario, such as the IV to PO, that each of the clinical scenarios provides a case study and a steward that a steward may encounter in their practice. So they're very, very practical clinical case studies that were compiled from many different hospitals that the DASAN group works with. This is the screenshot for the IV to PO conversions. The example is that the hospital leadership requested that the stewardship program track and report IV and PO doxycycline to optimize patient care and cost. Next slide. In this scenario, the interactive web-based tools provide the stewards with step-by-step instructions on how to create data visualizations using NHSN extracts. On the upper left, you can see the quarterly doxycycline days of therapy, the numerator, stratified by oral and IV route. And then on the lower right-hand graphic, this shows the percent of doxycycline days of therapy administered orally. And based on the scenario, some of the data visualizations are linked to existing NHSN resources, and then some are new created by exporting these data to an Excel template. Next slide. The IV to PO clinical scenario also provides enhanced data visualization, often called augmented on the website. And this is for those hospitals or healthcare systems that may have additional local data sources that are available to the stewardship team. And you can see here that the ones that we are calling enhanced or augmented are highlighted in yellow on the website, while the more standard derived only from NHSN AU data was in blue. The upper left figure shows the provider selected clinical indications for oral and IV doxycycline. And here is the most common indication is pneumonia. And once again, the website and the videos will show you step-by-step how you can create these graphics if you have these additional data. And then the second figure on the right stratifies the days of therapy by prescriber to assist with audit and feedback for stewardship intervention. Next slide. Like every scenario, the IV to PO case study provides potential stewardship interventions and then links to resources specific to that scenario. And once again, this is very practical examples of how you could further enhance if you have an IV to PO protocol or potentially other clinical scenarios that you can really think of how to enhance IV to PO and then linking those resources. Next slide. And then the clinical scenarios end with suggestions for using the data for ongoing monitoring. And here's an illustration of over time that you can monitor and potentially report back to your hospital leadership. Next slide. As part of the interactive web-based tool, so not specific to the IVDPO scenario, there are also slide templates for presenting on NHSN AU option to hospital leadership. And this provides the 3-minute leadership opportunity in case you have that at your institution. This is just suggestions, and it's adaptable because it's in PowerPoint slides, so you can put your specific data in or add slides as you deem appropriate. Next slide. The last section of this presentation, I'll highlight new guidance and resources. Next slide. The hospital core elements proved to be an effective framework and were adopted to healthcare settings to guide efforts for improving antibiotic prescribing. Here you can see they were adapted for nursing home and outpatient and specific implementation for small and critical access hospitals, as well as low and middle income settings. And we found that this was also adaptable to health departments. And we just released the core elements of antibiotic stewardship for health departments this past fall. State and local health departments play an important role in guiding antimicrobial stewardship efforts. Next slide. A portion of CDC 19 supplemental funding was dedicated to public health antibiotic stewardship. Most health departments have a stewardship lead. Next slide. Most state and large local health departments have a stewardship lead, and the core elements document outlines opportunities for hospitals to partner with their health departments. For example, hospital stewards can participate with health departments' external multidisciplinary advisory group that can support the stewardship leadership or co-leaders at the health department on identifying and implementing the most effective stewardship strategies in different healthcare settings. Health departments also can form stewardship collaboratives with academic institutions, healthcare facilities, and other partners in different healthcare settings. And then hospitals can also partner with their health department on educational and communication efforts, such as U.S. Antibiotic Awareness Week activities. We know that many state health departments have NHSN AU user groups and also specifically focus on data within their jurisdiction. Next slide. The core elements was adaptable beyond stewardship. Many of you know that last year the CDC also released the Hospital Sepsis Program core elements to outline structural and procedural components that are associated with multidisciplinary expertise required to support the care of patients with sepsis. The core elements emphasize integrating sepsis activities into antibiotic stewardship activities and engagement of antibiotic stewards in the development of sepsis treatment recommendations. So this is very complementary. In the hospital core elements, we also want and really highlight the importance of engaging stewardship partners in the stewardship guidelines as well. So it's really a nice collaboration for stewardship and sepsis. Next slide. CDC communication material outline how all healthcare professionals can be antibiotics aware in different materials and resources. Next slide. We heard from partners that some of these resources are hard to find on the CDC website. So last year we launched what we call antibiotic stewardship bundles. And these bundles organize CDC resources by healthcare settings and provider type. You can see here we have outpatient, nursing home, inpatient, as well as transitions of care. Next slide. And here is an example of the transition of care bundle. This shows a fact sheet of stewardship considerations at hospital discharge, including a social media graphic, which is newly released, you can see on the right-hand side, and then resources for optimizing duration, specifically for pharmacists. And the bundle also links to CDC-funded resources developed by the Henry Ford Healthcare System to implement stewardship at hospital discharge. So this is an example of the transition of care, but it's very similar for outpatient nursing homes as well as acute care. Next slide. We funded IDSA through a cooperative agreement to create a clinical pathway for the diagnosis and treatment of a community-acquired pneumonia based on the ATS IDSA clinical practice guidelines. This was just posted this past fall. The clinical pathway incorporates diagnostic and antibiotic stewardship principles. And along with this clinical pathway, there is a 20-minute webinar that provides a clinical overview of the pathway in tables. And what's important to note is that this clinical pathway can be adapted. It's in a Word document. I know that many of you already have clinical pathways for pneumonia, but I do encourage you to review this clinical pathway and determine if there's opportunities to work with your P&T committee and key partners to incorporate potentially some components that you don't have in your clinical pathway, and using this as a template. The IDSA panel is also, it's actually a different panel, but they're also a different IDSA panel is also going to be providing an overview of diagnostic and antibiotic stewardship principles in a manuscript that is further being developed. We hope that this will be published in the upcoming year, and then will further complement not only the clinical practice guidelines and the pathway, but then we'll also really have a document of incorporating stewardship principles into the treatment of community-acquired pneumonia. Next slide. In an effort to ensure that all patients receive antibiotics appropriately, CDC recently published a scoping review that identified variations in antibiotic prescribing with patient and clinician level characteristics. The majority of these data are from outpatient settings with limited published data on the inpatient setting. It's something that we hope that we can fund in the future. Next slide. By engaging with antibiotic stewardship efforts, we hope that clinicians can ensure improving the quality of prescribing for all patients. Researchers can improve the understanding of drivers of inequities, especially in the hospital setting. And healthcare systems can also play an important role of incorporating a health equity lens into quality improvement activities. We encourage you to review our publication and definitely consider some of these action items within your healthcare system. Next slide. CDC worked with the Society of Healthcare Epidemiology, or SHEA, through, once again, a cooperative agreement to host a one-day educational program in advancing health equity through antimicrobial stewardship. The meeting was held last year in the fall, but the content is available free online to the end of this year. The learning objectives focus on describing health inequities as they relate to antimicrobial use, antimicrobial resistance, and antimicrobial stewardship, to define gaps and opportunities in antimicrobial stewardship equity, to identify resources and available and specific collaborative actions within stewardship teams, as well as other stakeholders aimed at mitigating antimicrobial prescribing inequities. So definitely encourage you to utilize this online resource as well. And then CDC also updates its online training on antimicrobial stewardship. I've been saying this for many years, but as part of the CDC CE process, we do routinely update these modules and would encourage you to reconsider taking these. One caveat is they're mostly focused on outpatient antimicrobial prescribing aimed at frontline providers, but many modules can be useful for healthcare professionals in other settings. The first three modules are a broad overview of antimicrobial stewardship and patient safety, and then there is specifically a module on hospital antimicrobial stewardship, as well as there'll be an updated one focused on ED in the near future. And this course is available for CE for many multidisciplinaries, such as physicians and pharmacists and nurses and others.